Continue to focus on the coronavirus pandemic here on Eyewitness News at 9. We're also focusing on your concerns and questions about the virus. Dr. David Schultz with Evansville Primary Care joins me again tonight to answer many of your questions. Dr. Schultz, thanks for being with us again tonight. First off, it was announced today that the Department of Health and Human Services and AstraZeneca have teamed up to produce a vaccine for the coronavirus that could be available by early October. Now, that obviously is much faster than originally expected. We talked a lot about vaccines here. How do you put a new vaccine like that on the fast track as they're doing?
Brandon, it's very difficult to introduce a vaccine new to the public on a fast track. That's not easy because, first of all, they have to make sure the vaccine is safe, and secondly, they have to make sure it's efficacious, that is, it works. And to do so, you have to see reproducible data. In other words, when studies are performed on these vaccinations, you need to make sure that it's going to be safe for the general public and the population that's studied, and you have to make sure it produces an adequate antibody response. That said, with the seriousness of the coronavirus, they're dropping a lot of those traditional restraints in examining and evaluating data in lieu of trying to get a vaccine out that possibly could help put an end to this pandemic.
And there are reports that it would be a single strain vaccine as opposed to the flu vaccine, which is a multi-strain vaccine. Why is that?
Well, the reason is because there are marked differences in the organisms and so forth, and also there's marked differences in how the organisms spread around the globe. So with the flu vaccine, there are several strains that are dominant depending on the parts of the flu strain that are active in early studies. They study that actually during the early summer months and late spring, and then determine which strains are going to be dominant. Whereas this is a RNA virus, and this RNA virus only will require a single strain type of vaccination. It will not require other multiple strains to be studied.
Okay. Would it be like other vaccines where after you get it, it may take a few weeks before it becomes effective?
Generally, most vaccinations take a minimum of 30 days to become effective as a vaccine, and that's because it takes that long for the antibodies to be developed. And this new vaccine, if it comes to fruition, will be much like that as well.
And once a vaccine does become available, do you believe that it would be provided to healthcare workers and those considered at risk first before the general public?
I think you'll see, Brandon, both of those happen simultaneously. I think it'll be more easily available to the healthcare workers because the hospitals and the hospital systems generally distribute those vaccines first. That's outside of the retail markets and so forth. And so it'll be more easily available to the physicians and nurses and the hospital workers before the general public. However, I think you will also see the pharmacies and some of the other independent agencies out there get vaccines soon after. I don't think this is going to be a long separation between when healthcare workers get it and the general public.
Interesting. Okay. Do you think that this would be a situation where we'd have to go to a certain place to get the vaccine, like a lot of people are doing right now with the coronavirus test, or is this something we could go to our doctor's office to get?
Well, Brandon, I think it's going to depend on the location. I think there will be some areas where the county health departments actually will be very instrumental in providing that vaccine. And there may be other areas, for example, that utilize the school systems to help distribute the vaccines to children. But as far as most people and individuals, I think we'll see it split between the pharmacies, and I think you'll see it sent to the regular doctor's offices and then the hospital systems. I think initially we will see it mainly at the hospitals, and then as more vaccines become available, you'll see it distributed to those other places. At least that's how it should be in the tri-state area.
Yeah, okay. Well, we're nearing the end of another week here, and you're starting to see more patients come into your office for a visit. What are some of the concerns and questions that they have for you?
Well, a lot of individuals are worried about how long is this going to last. We're already seeing several individuals out there who have pre-existing psychiatric illnesses and diagnoses having problems. We're seeing a lot of anxiety. We're seeing some even with post-traumatic stress disorder having problems, and we're seeing quite a bit of people with depression have problems. One small population, though, that's large to our heart, are the autistic children and those who are on the spectrum. And they have really had a hard time with this, Brandon, because they're used to certain regimens, they're used to certain routines. And right now, our children and our adults with autism and special needs, they're way outside their element and way outside the routine, and they are struggling right now.
We are all hoping to get back on our old routine sometime soon. Dr. David Schultz, thanks so much for taking the time to talk to us tonight.